I am Matthew, and I am from the state of California. If it's helpful, I can start with my background as well and kind of what happened with my injury.
Sure.
So I had severe pain in my right foot, Morton's neuroma, in both the second and third and fourth interspaces.
Yeah.
And I had gone to a podiatrist many times and had cortisone injections and a variety of other treatments that didn't help the injury at all. And I dealt with this for about a year and a half until my podiatrist recommended surgery. And he recommended a double neurectomy, which was a removal of both nerves in both of the interspaces of my right foot. Without fully disclosing or discussing all of the risks that surgery entailed. And long story short, I had the surgery. It was incredibly painful, and I had some severe complications where I got a stump neuroma in both interspaces in my right foot, which was incredibly painful. And my pain was exponentially worse about 4 months after the surgery. And so I was pretty frantic and pretty upset about that, and had researched many different treatments and opportunities, and stumbled upon the Morton's Neuroma website. And I was very relieved to find out that there was potentially a solution for my complicated and severe case that did not involve a second and potentially even more risky surgery where I could be permanently disabled in my right foot. Yeah, so I came to the clinic, I found you guys, and I made the trip out to Massachusetts and met with Dr. Pearl, and she did the initial diagnostic where she injected, I believe, the lidocaine or some other numbing agent, and I walked around. We had a bit of an interesting moment in the clinic where I could walk normally for a little bit, and I was just so relieved and so excited that I would have potential to fix this injury, because I was very desperate at this point. I hadn't been able to be active for months, and it was really wearing on me. And then I came back the following day, or 2 days later, and we did both the radiofrequency ablation in both interspaces, as well as the PRP treatment, which Dr. Pearl typically recommends for patients that have severe post-surgery pain.
Right.
So I had both of those treatments in both interspaces in my right foot. Yeah, so it was pretty straightforward. I came in about an hour before my appointment and had blood drawn, which was a pretty straightforward process. And then the blood was spun in a special machine to separate the plasma. And then during the procedure, after I had each of the radiofrequency ablation procedures done using the same needle, Dr. Pearl injected the plasma back into the injured area. And that definitely it wasn't too painful during the procedure. It was definitely painful afterward, given the amount of trauma I'd already had in the area. But that was what really, really, really helped my recovery. Explained to me, and I thought it was a pretty good analogy. The radiofrequency ablation was to kind of kill or burn the pain, the nerve itself, which was causing me a lot of pain. And the PRP was kind of to heal the neighborhood, so to speak, to heal the trauma and the scar tissue and all the issues that had resulted from this traumatic injury to my foot that were kind of entangling and entrapping the nerve, making it extremely painful to walk on that weight-bearing area of my foot. So I felt like the PRP, in addition with the radiofrequency, getting rid of the nerve pain, the PRP really helped with the scar tissue and the other issues surrounding the wound cavity. My pain was really, really bad. I've had many shoulder operations and other injuries in my life, and I had never experienced nerve pain before. And it was to the point where it was debilitating. I couldn't walk. I couldn't wear a normal shoe. I was basically immobile for, it was actually 6 to 8 months before I came into the clinic, hoping that my injury would recover. So I was essentially immobile. I couldn't walk normal at all, and I was in a severe amount of pain. And after my second treatment with Dr. Pearl, it's been about 4 months now.
Yeah.
And I just went to the gym. I'm running. I'm working out. I'm playing basketball. I'm doing plyometrics. So it's been extraordinary, the results I've seen with Morton's neuroma, and I'm very, very happy and grateful about it. Active males, super active, 30, hopefully still young. Or characterized as young, and I was immobile from this failed surgery that should never have happened in the first place. Honestly, I have spent dozens and dozens and dozens of hours researching this after the surgery to find a solution, and I do not believe there is a place on this earth that could have helped me as much as the Center for Morton. And I would have done 10 times the investment to be able to walk and be active again. You really, taking your health for granted is something that I've done before, and to not be able to walk normally is something that was very traumatic. Yeah, there's a couple things. Number one, anyone who's suffered from Morton's neuroma needs to understand that surgery is the absolute last option after everything has been exhausted. And I don't say this to spite podiatrists, but I think sometimes surgeons or doctors in general can be a bit revenue driven, and meaning they will recommend perhaps a surgery for someone when it is not necessarily needed, or when not all the other options have been exhausted. And it may not be intentionally. Doctors don't know about what's being offered at Morton's Neuroma. Right. So my advice is, number one, do not get surgery until you have exhausted all options. And what that means is, come to Morton's Neuroma, try the radiofrequency ablation, try the stronger sclerosis injections, which are not what your podiatrist will be giving you. They are much different and much better. Try all of these options before ever even considering a surgery, especially a surgery like the one I had, which is a neurectomy, where the nerve is actually, a portion of the nerve is removed. It's minimally invasive. Do the procedure before ever considering surgery. And then if you've had surgery, please explore the Center for Morton's Neuroma option before getting a second surgery. The numbers are just, the numbers are terrible around. I mean, you're dealing with cutting and removing a nerve, which has an extraordinarily high risk of a neuroma and severe injury. I think folks sometimes can look at making a longer distance trip for medical care and kind of default to, oh, well, there's a doctor in my area and that might be easy. I would strongly caution against, first of all, any type of surgery, and second of all, having that mentality of, well, I'll just go somewhere that's nearby, because it's a little bit cheaper. When you're dealing with your health, I've learned over and over again that going to someone who specializes in your particular issue and can diagnose it and help you out is worth so much more than the investment of money to get it done. So that's my recommendation, is think outside the box a little bit. And especially for those that are desperate at this point, this is the place to go. Don't waste your time going to another podiatrist, going to another orthopedic surgeon, having another recommendation for a surgery. Just come and get the work done, and you'll be incredibly grateful you did, because I am. I visited with a couple different podiatrists around this issue, and in fact, 3. I met with 3 different doctors, and I was very impressed by Dr. Pearl's understanding of what's currently out there and why this particular solution is better and more helpful for the patient. Not because she can make more money by recommending one course of treatment or another, but because it really felt to me like she had the patient's best interest at heart. And I found that to be very helpful. And she's just great around overall. She was very calming and relaxed during the procedure itself. And she really understood when I was describing the type of pain I was having, when I was having the pain, why I thought I was having the pain. She, much more so than anyone I'd met with, really had an understanding of what I was dealing with. And beyond that, was using state-of-the-art technology and an approach that nobody else was doing. And I really, really appreciated that.